Liverpool Heart and Chest Hospital, NHS Foundation Trust. Information for patients and carers on lung surgery. Liverpool Heart and Chest Hospital, NHS Foundation Trust. Thomas Drive, Liverpool, Merseyside, L14 3PE. Telephone 0151 221 1616. www.lhch.nhs.uk. This booklet has been prepared to help you and your family understand more about the operation that is planned for you. It will give you general information about what to expect from the time of your admission to your discharge home. It will also give you some practical advice about what to do when you get home. However, it is not intended that this booklet will replace talking with medical or nursing staff. At the end of this booklet you will find a list of organisations that may be able to provide further information. If you have any questions you wish to ask during your admission or your outpatient appointment, it's a good idea to write them down or take someone with you who can remind you of them. Your lungs and how they work. When you breathe in through your nose or mouth, the air passes down your windpipe, the trachea, which then divides into two tubes, bronchus, one going to each lung. Each lung has a number of subdivisions called lobes. The right lung has 3 lobes and the left lung has 2. Trachea or windpipe carries air from your throat to your lungs. The bronchial tubes branch off from the trachea, carrying air to each lung and to each lobe within each lung. Lobes are distinct sections of the lung. The chest wall is made up of ribs and muscles. The pleural space is the space between the lungs and the chest wall. The mediastinum is the area that separates the two lungs. And lymph nodes around your lungs filter fluid from your lungs and help your body defend itself against infection. Reason for operation. Your surgeon will have discussed with you that the appropriate treatment for your condition is to remove the diseased part of your lung. The amount of lung to be removed will depend on the size, position, type and extent of the disease. There are various conditions which can be helped by removing the affected part of the lung tissue. If you have any questions about your particular condition and your treatment options, you will be able to discuss them with your consultant, specialist nurse or GP. What are the benefits of having lung surgery? Your consultant will discuss with you the perceived individual benefits of having lung surgery. In the majority of cases, an operation is recommended with a view to alleviating symptoms and in some cases improving the quality and length of your life. What are the risks involved? As with all surgical procedures, lung surgery carries some risks. These risks vary according to the type of operation, your overall health and your individual condition. You will have an opportunity to discuss the risks and the benefits of the proposed surgery so that you have sufficient information to be able to sign the consent form. Some of the risks involved with lung surgery include wound infections, bleeding and inflammation of the lungs, pneumonia. There is also a risk of developing a collapsed lung, pneumothorax. If this happens, you may require treatment to help reinflate the lung. Developing blood clots in the leg, deep vein thrombosis, or in the lung, pulmonary embolism is another possible risk. What operations may I need? This depends on the extent of the disease and the amount of lung to be removed. The following types of lung surgery are performed under a general anaesthetic and usually involve staying in hospital between 7 and 14 days. Wedge resection is the removal of part of the lung in a wedge-shaped portion. Lobectomy is the removal of one lobe of the lung. There are 3 lobes in the right lung and 2 in the left. Punectomy is the removal of the whole of one lung. Thoracotomy is the surgical incision or the wound made in the chest wall to enable the surgeon to get to the lung. On some occasions it may be appropriate only to take a sample, biopsy, of the diseased area for further testing. Your consultant will discuss with you what your operation will involve and how it will affect you afterwards. If you require further information, please ask questions. Following your surgery, your consultant may discuss with you referral to another specialist for consideration of additional treatment to get the best result from surgery, for example, chemotherapy or radiotherapy. What are the alternatives to lung surgery? This depends on your condition. Alternatives to lung surgery for cancer include radiotherapy, chemotherapy. Your consultant will be happy to discuss other treatments if they are applicable to you, and make the appropriate referral to an oncologist to discuss these treatments. Before coming into hospital, if you smoke, giving up before the operation can reduce the risk of breathing problems. The longer you can give up beforehand, the better. If you would like some information and support to stop smoking, please ring our smoking cessation advisor on 0151 600 1455, who will arrange to see you, or alternatively speak to your GP. If you're taking medication, you should bring a supply of them with you on admission. Please keep them in their original box or bottle. Pre-admission clinic. You may be invited to attend a pre-admission clinic prior to coming into hospital. You will have various tests in preparation for your surgery and meet with a nurse practitioner who will talk to you about the procedure and about recovering afterwards. The nurse practitioner will be able to discuss any questions that you may have. You may find it useful to prepare a list of questions prior to your appointment, as it is important that you fully understand the procedure and aftercare arrangements. After admission for your operation, dependent upon what investigations you've already had done, your consultant may bring you into hospital a few days prior to your operation. Some of the following tests which may be carried out. Chest X-ray. This will look at the size and shape of the heart and the general condition of your lungs. Electrocardiogram Ecg. This shows the electrical activity of the heart and is routine for anyone undergoing an anaesthetic. Blood tests. A blood sample is taken from your arm and various tests are carried out, including your blood group. Pulmonary function tests. These are breathing tests which measure how well your lungs are working. CT scan, CAT scan. This is a type of X-ray that produces detailed cross-sectional images from inside your body. Bronchoscopy. This is a procedure carried out under general anaesthetic. It is a test that allows the doctor to look directly down your windpipe and into some areas of your lungs. The doctor is able to view both lungs by passing a long, thin tube with a camera and a light on the end of it, a bronchoscope, down your throat. During the test, different procedures may be performed in order to obtain samples for further examination in the laboratory. Before the operation, eating and drinking. You will not be allowed to eat and drink anything for several hours prior to the surgery. The nursing staff will inform you to stop eating and drinking. It's important not to eat or drink anything after this time, as it may delay your operation or cause complications with your anaesthetic. Bathing. It will be necessary for you to have a bath or shower before your operation. The nursing staff will advise you when the best time for you to do this is. They will also provide you with an antiseptic skin wash to use. This will help to prevent any infection occurring in your wound. If you need assistance, please inform the nursing staff. Shaving. Before the operation, it may be necessary to remove hair from around the operation site. Your ward nurse will discuss this with you. Stockings and gown. You'll be given a theatre gown and a pair of elastic stockings to wear prior to going to theatre. The stockings are to help your circulation and blood flow whilst your mobility is restricted. Pre-medication. If prescribed by your anaesthetic, you'll be given medication before your operation. This is given to help reduce or relieve anxiety. Following the pre-medication, you must stay in bed and call for a nurse should you need anything. You may also be given some oxygen. A ward nurse will accompany you to the theatre and will stay with you until you're introduced to the anaesthetic nurse. Family. Your family may wish to visit you on the day of your operation and during your stay. They should discuss visiting arrangements with the ward nurse or ward manager. After your operation will take approximately 2 to 4 hours, following which you will regain consciousness in the recovery area of the theatre. There will be a nurse or practitioner in attendance who will monitor your blood pressure, pulse rate and oxygen levels. It may be necessary for you to spend a period of time in the high dependency unit or intensive care unit before returning to your ward. Breathing. While you are still recovering from your anaesthetic, you can expect to have an oxygen mask over your mouth and nose. It's important that you take deep breaths and cough. This will help to expand your lungs and prevent infection. Infusions and catheters. Whilst you are asleep, a drip will be placed in a vein in your arm or neck, which will allow you to have any drugs or fluids required. You may also have a catheter, a fine tube, in your bladder, which allows urine to drain freely. These will be removed as soon as possible after your operation. Pain. Effective pain relief is important following surgery for comfort and recovery. You may be given pain control through a fine tube in your back. This is known as an epidural, or alternatively via a patient-controlled analgesia device in your arm, which will help to keep you comfortable. It's very important that you let the staff attending to you know if you're experiencing pain, as they will then review your pain relief. Chest drains. Following surgery, you may have 1 or 2 chest drains. These are tubes leading from your chest to a bottle, which drain air and fluid. The chest drains may be attached to suction, which is a mild vacuum, and this will help your lung re-expand more quickly. This does, however, restrict your mobility in moving around the bed area, as the drains cannot be disconnected from suction unless the doctor feels that your condition allows this. It's important to keep the chest drain bottles in an upright position. If the bottle gets knocked over or disconnected, please ring for the nurse immediately. The ward nurse will discuss with you how to look after your drains. Removal of the chest drains. The chest drains will be removed when they are no longer required. Usually this occurs after 2 to 3 days, although sometimes it takes longer. This will be explained to you by the doctor Prior to removal of your chest drains, you will be given pain control. Once removed, you will